Welcome to today's lesson on the human and financial cost of non-communicable diseases. In this session, we will explore the impact that diseases have on individuals and broader society. Today, we will examine the different ways that non-communicable diseases influence human life, including how they affect individuals' health and quality of life. We will also look at the economic burden that these diseases impose, from healthcare costs to lost productivity and income. So far, you have learned what non-communicable diseases are, such as heart disease, diabetes, and cancer. You have also been introduced to some of the risk factors that are associated with these diseases, such as poor diet, lack of exercise, smoking, and excessive alcohol consumption. We can now recognize the impacts of these diseases on an individual and societal level. Understanding the human and financial costs of non-communicable diseases advances our biological understanding by highlighting the real-world consequences of lifestyle choices and health management. This is essential for developing effective public health strategies and policies aimed at preventing and managing non-communicable diseases. To understand the significant impact of non-communicable diseases, we need to look at both their human and financial costs. Individuals suffering from non-communicable diseases may experience a diminished quality of life. Symptoms such as chronic pain, fatigue, and mobility issues can limit daily activities and overall enjoyment of life. These conditions can also shorten an individual's lifespan. For instance, complications from diabetes or severe heart disease can lead to premature death. Family members often become caregivers to those affected with disease, which can be physically and emotionally exhausting. The stress of caring for a sick loved one, along with the fear of losing them, can significantly impact mental health. In summary, the human cost of non-communicable diseases extends far beyond the affected individuals, permeating their social and family circles. The financial burden of non-communicable diseases is also significant and can be seen at various societal levels. Treating non-communicable diseases requires substantial healthcare resources. The NHS, for example, allocates a large portion of its budget to manage these conditions, covering hospital stays, surgeries, medications, and specialized care. Continuous research is necessary to develop new treatments and potentially curative measures. This requires investment in clinical trials, laboratory research, and development of medical technologies. When individuals are unable to work due to their illness, it reduces the household income, which in turn affects their living standards. This can have effects on the economy as a whole, leading to reduced productivity and increased welfare support. Let's consider a hypothetical example to illustrate the human and financial costs of a non-communicable disease. Imagine a middle-aged individual has been diagnosed with advanced heart disease. This person might experience severe chest pain, fatigue, and reduced ability to carry out daily tasks. Their loved ones would need to provide constant care, and their social life might shrink as a result. On the financial side, the cost to the individual and national health services would include multiple doctor visits, expensive medications, and possible surgery. If this individual could not continue working, their family's income might decrease, and they might have to rely on financial support from the government. In today's lesson, we examine the human and financial costs of non-communicable diseases and how lifestyle choices can influence their development. We explored how non-communicable diseases can impact quality of life, lifespan, and one's family. This extends to financial issues due to the costs of healthcare resources, research, and the impact on living standards. Understanding the extensive human and financial costs associated with non-communicable diseases highlights the critical need for effective prevention and treatment strategies. By addressing lifestyle factors and investing in healthcare and research, societies can mitigate some of these impacts. This will improve quality of life and economic stability.